If you have atrial fibrillation or flutter, your doctor may prescribe Dofetilide to help control your irregular heartbeat. Dofetilide is an anti-arrhythmic drug that works by blocking certain electrical signals in the heart that can cause an irregular heartbeat. By restoring a normal heart rhythm, Dofetilide can help reduce your risk of blood clots, heart attack, or stroke. It's important to take Dofetilide exactly as prescribed by your doctor, and at the same times each day. This will help maintain a steady level of the medication in your body and maximize its effectiveness. Always follow your doctor's instructions for the best results. Before you start taking Dofetilide, make sure to read the medication guide provided by your pharmacist. And if you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication by mouth with or without food, as directed by your doctor, usually twice daily. It's important to take it exactly as prescribed to reduce your risk of serious side effects. The dosage will be based on your medical condition, kidney function, and response to treatment. Make sure to use this medication regularly to get the most benefit from it, and try to take it at the same times each day to help you remember. If your condition does not improve or worsens, be sure to tell your doctor. Some common side effects of Dofetilide include headache, dizziness, or nausea. If these effects persist or worsen, it's important to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek medical help right away if you experience any very serious side effects, such as chest pain, fainting, faster or irregular heartbeat, or severe dizziness. While it is rare, a very serious allergic reaction to Dofetilide can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about any side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report any side effects to Health Canada at 1-866-234-2345. When taking Dofetilide, it can be very beneficial for those who suffer from irregular heartbeat. However, it is important to note that there is a rare chance of experiencing a new irregular heartbeat as a side effect. It is recommended that when starting, restarting, or increasing your dose of this medication, your doctor will advise you to stay in the hospital for at least 3 days for proper monitoring to ensure your safety. The daily dosage and optimal timing for taking Dofetilide will be determined by your doctor based on your individual condition and needs. Before taking Dofetilide, make sure to inform your doctor or pharmacist about any allergies you may have. This medicine may contain ingredients that can cause allergic reactions. It's important to also talk about your medical history, especially if you have kidney problems or liver disease. Dofetilide can make you feel dizzy, and drinking alcohol or using marijuana can make it worse. It's best to avoid driving or using machinery until you know how this medication affects you. Also, limit your alcohol intake and talk to your doctor if you use marijuana. This drug can affect the rhythm of your heart, which may cause serious symptoms that need immediate medical attention. The risk of this happening may be higher if you have certain medical conditions or are taking other medications. Be sure to inform your doctor about all the medications you are taking and any heart problems you may have. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems. This risk may be higher if you are taking certain medications or have certain conditions. It's important to talk to your doctor about using Dofetilide safely. If you are an older adult, you may be more sensitive to the side effects of this medication, especially the heart rhythm problems. If you are pregnant, talk to your doctor about the risks and benefits of using Dofetilide. Also, consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions with Dofetilide, as they can impact how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with dofetilide include dolutegravir and fingolimod. There are also many other drugs that can affect the heart rhythm, including amiodarone, pimozide, procainamide, quinidine, saquinavir, sotalol, macrolide antibiotics, and certain quinolone antibiotics, among others. It's important to take precautions and consult your doctor about any potential interactions. Additionally, other medications can affect the removal of dofetilide from your body, which may impact how the medication works. Examples of these medications include cephalexin, hydrochlorothiazide, indapamide, itraconazole, ketoconazole, lamotrigine, migestrol, prochlorperazine, tafenoquine, trilaciclib, trimethoprim, and verapamil, among others. It's also important to avoid taking cimetidine while being treated with dofetilide, and it's advisable to consult your doctor or pharmacist about other medications for heartburn or upset stomach. It's essential to be cautious and informed about potential interactions with dofetilide to ensure safe and effective treatment. If someone takes too much dofetilide and experiences serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach the local poison control at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Some symptoms of an overdose may include dizziness and fainting. Always seek medical help immediately if you suspect an overdose. It is important not to share dofetilide with others. Before starting and while taking this medication, you may need to undergo lab and/or medical tests, such as EKG and kidney function tests. It is important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget a dose, just skip it and take the next dose at your usual time. Never take a double dose to make up for the missed one. It's important to store dofetilide at room temperature, away from light and moisture. Avoid keeping it in the bathroom, and always store it in a place that is out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.